What's happening, Delco? I'm Rich Shane, and welcome to the What's Happening Delco podcast. Today, I'm joined by Dr. Ina Solovey of SmileForm Dentistry. Dr. Ina, welcome to the podcast.
Thanks, Rich.
I'm so happy to have you, and we had you on a spotlight video a while ago. I know some things have changed, but for those that did not see the spotlight and do not know you or SmileForm, what do you do?
So I am a family and cosmetic dentist in Edgemont Square.
So Dr. Ina, what can people expect when they come to SmileForm?
So when you come to SmileForm, you will see smiling faces. You will see a very friendly environment, and you can always see me there. I'm the only dentist practicing every day, so there's continuity of care. We've also got brand new technology that will help with any treatment needs.
Now, what sets you apart?
So I would like to say what sets me apart is that I really care about each and every patient. I take my time with every patient. I get to know them. I create a treatment plan that is individual to every patient. And I love what I do.
How did you get into dentistry? You sound like you really love the whole world of dentistry. How did you get into that?
I do love it. So actually my dad was a dentist, so I guess it's just something that I grew up with.
So you grew up in a world where you were actually, you had access to all the picks and all the drills, and you would go into his dentistry office as a kid?
I did. Yeah. I mean, it was a long time ago. So dentistry was very different then than it is now. But I definitely remember being in his office and loving all the little instruments and everything that he used, for sure.
That sounds like, as a kid, that sounds like so much fun to get into. Where do you think, from what you perceived, I guess, as a kid to where you are now, what's really changed in dentistry, or what significant items or treatments, what's changed?
So much has changed. I mean, all the technology, all the digital, we're doing like the digital scanning and sending files over to the lab instead of actually taking mixing impressions, what they used to do back in the day. I mean, my dad was a dentist. He didn't even wear gloves when he was a dentist. So, lots of things have changed.
Wow. I can't imagine what that must have been. I don't even remember what it was, what that was like when dentists didn't wear gloves.
Yeah.
You mentioned some things there about impressions and digital work. Talk about some of those features.
Yeah. So a lot of times if you need any dental work done, like if you need a night guard or a crown, we need to take a copy or an impression of your teeth or of your mouth. So before, we would mix this material. It was all gooey, and we put it in the mouth and it hardens, and that's how you take your impression. What we do now is, absolutely nothing is gooey. You're not you don't feel like you're gagging on anything. It's a scanner that goes around your teeth, basically takes a bunch of little pictures, and it's a file that we then send to a lab to fabricate whatever needs to get done.
That sounds even more accurate than what that gooey, yucky stuff that you put in people's mouth.
Yes, it is 100% accurate. Pretty much, we never adjust any crowns or night guards or anything that we make for our patients.
In dentistry, who motivates or who mentors you? Who do you look up to? Who do you go to as a resource when you're looking to learn something?
Yes. So I've got, friends and colleagues who I've known for a while. There's CE or continuing education courses that I love and I take. I'm actually starting an implant course at the end of August. And it's going to be a 6-month thing. I'm doing it online and in person. There are also different schools of dentistry, and there's the Spear Education Club, and you meet with other dentists and you go over things and cases and stuff like that I'm a part of that I love.
Was there ever a dentistry summer camp or something?
I wish that would have been great. No, but there are retreats and stuff that, kind of like a summer camp. That's, a bunch of dentists get together and discuss and, geek out and stuff.
Where we are in the current world of the pandemic and different things coming at us, or different conversations each day, it feels like it's waning a little bit, but we don't know what might be coming down the pike, so to speak. Mm-hmm. For your patients, those COVID related or your practices, what's changed or what are you still doing now for patients' comfort and that health, overall health safety?
Sure. Yes. So we do. So we used to take temperatures at the door. We don't really do that anymore. We do offer masks for anyone who wants a mask when they come in. If they don't have one, we have a questionnaire before your appointment to question whether you've had a fever or any symptoms. Dentistry has always been really good at like using the PPE and using the gloves and the masks and the shield. Like that has always been our practice. So as for my end, nothing's really changed except for, if the patient comfort is the most important thing. So if someone's not comfortable coming into the dentist, if they have symptoms, they reschedule. We, of course, always wipe everything down, sterilize all our instruments, clean thoroughly between every patient. The waiting area is cleaned all the time. The handles, like we've been doing that always. So yeah, and I think what COVID is, I've noticed, we've been doing some kind of like Zoom dental consults, which we didn't used to do before. So if someone has a question they'd like to ask a dentist or any concerns, they can actually schedule like a video call, which was never really a thing before COVID for dentists, I don't think.
So would I put my mouth up to the camera and open my mouth? And yeah. That's got to be very interesting, to say the least.
I've had patients take a picture of like their, the back of their tooth or something and send it to me and then we can discuss. Yeah.
That is very interesting. Yep. Talk about, right now, I think that dentistry is, you talked about the innovations in technology. What seems to be some of the apprehensions is maybe why somebody hasn't gone to the dentist in a while, or why you think that people should be aware that they should go to the dentist? And I'm going to give you a couple of areas to focus on here, but how often should somebody go see a dentist? And what are some of those apprehensions that you still see?
Sure. Yeah. I mean, so the American Dental Association recommends you see the dentist at least twice a year or every 6 months. So that's definitely what I do recommend as well. You definitely want a cleaning, we check for any areas that may look suspicious, whether there's a cavity forming or, something that looks like it's going to fracture or already a fracture. We also do oral cancer screening at every visit. So that's really important. We check areas of the mouth that you can't ever see that may not bother you, but if anything looks suspicious, whether we need to address it or biopsy it or something like that. So that's really important to get that checked every 6 months. Some apprehensions, I think people, to be honest, I don't think anyone loves going to the dentist. I do have patients who say they love me, they just don't like being at the office, and I get it. But so some apprehensions there, and some people are anxious. And then I guess with COVID, people have been avoiding, or maybe because of COVID, they've been just, a bit scared to go to the dentist, but we definitely take every precaution. And we haven't had any cases that like started or that have spread in the office. And I'm in a lot of dental groups and we haven't heard that happening.
What I heard you say is, look, if you have not been to the dentist in a while, schedule today. If you don't have a dentist, schedule with Dr. Solovey at SmileForm. You are accepting new patients, right?
Yes, we definitely are accepting new patients. We accept most PPO insurances. We also have an in-house membership plan that's very affordable. We have new patient specials, stuff like that. So yes, we would love to have new patients. Because
you're really concerned and you want to make sure people are in optimal dental health, right?
Absolutely. Yes. I love prevention. I love catching things before they start to be a pain or,
or a discomfort
or a discomfort or any. Yes. Yes. We want you to feel and look good.
So why Delco for you? What is it about Delco?
I like Delco. I like the feel. So far, all the people that I've met have been really cool, really down to earth. It's a great environment here. I just like it.
Now you're going out for a cheesesteak. Where are you going?
I'm going to Delco Steaks.
Where are you going? Delco Steaks?
Yep.
Awesome. Awesome. And now if you decide, all right, I had a steak yesterday, where are you going for pizza today?
Well, I'm going to Newtown Square Pizza.
Okay, Newtown Square Pizza.
Yeah.
Now, if you had friends or family coming in to Delaware County, they're coming to visit you, you want to take them somewhere, where are you taking them for that overall Delco experience?
So, you know what? I don't know if this is an overall Delco experience, but what's really close to me here is Reyes Deca, and I love sitting outside and having margaritas. So I think that's where we'd go.
Outside having margaritas after maybe getting a little cleaning? Why not, right? If you needed that convenience store option, where are you going? Wawa or Royal Farms?
Wawa. Yeah.
What motivates you? What inspires you? What gets you out of bed?
I think it's I love coming into the office and communicating with my patients, laughing with my patients, getting to know them, seeing them over and over again. I mean, just last week, I had a 2-year-old patient in the office, followed by like an 80-year-old patient. I love the diversity. I'm never bored. It's just, I love the people interactions.
So did the 2-year-old and the 80-year-old still have the same amount of teeth?
Not always. Sometimes.
Not always. Dr. Ina Solovey, how do people find you?
So you could find us on our website is SmileForm-Dentistry.com. You can call us at 267-702-0155. We're also on all the social media. So we're smile.form on Instagram, SmileForm on Facebook, and come visit us at the Edgemont Square. We're 4753 Westchester Pike.
I'm so grateful for your time today. This has been a treat. I love talking dentistry with you. And the last time I was there, I love to see all the, equipment. To me, when we talked about you being a kid and that be dad's office, my dad was an accountant. So the only thing I could really mess around with was an adding machine. So that wasn't as much fun as you had. But thank you so much for being a friend of What's Happening Delco. If there's anything, we can do to help you, don't hesitate to reach out. But look, again, if you haven't been to the dentist in a while, you got that discomfort, that pain going on, make an appointment today, because the most important thing is your smile, right?
Yeah. And Rich, thank you so much for your time. I always love speaking with you.
Well, we look forward to continuing and seeing you again, and we'll talk with you soon.
Thanks a lot.
Thank you.